In a healthy adult, there are two normal heart sounds heard during auscultation, S1 and S2. But sometimes you might hear an extra sound which can be either the third heart sound S3 or the fourth heart sound S4, or sometimes even both. In this video, we learn about the third heart sound S3, its clinical significance, and how to differentiate it from other diastolic sounds like opening snap or a split S2. S3 or the third heart sound is a low-frequency mid-diastolic sound which occurred during the rapid ventricular filling phase. It's also known as S3 gallop or proto-diastolic gallop or ventricular diastolic gallop. There are three theories which explains the mechanism of production of S3. They are the valvular theory, the ventricular theory, and the impact theory. But what we need to know is the sound is produced due to the vibrations caused during the rapid ventricular filling in the early diastolic phase into a stretched ventricle, which usually happens in condition with increased end systolic volume, secondary to LV dysfunction. S3 need not be always pathological and can be normally heard in children or young adults or in the third trimester of pregnancy or even athletes. Pathological conditions where S3 can be heard are heart failure, ischemic heart diseases, dilated cardiomyopathy, valvular heart diseases like mitral regurgitation or tricuspid regurgitation, condition where there's hyperdynamic circulation like anemia, thyrotoxicosis, and some of the congenital heart diseases. If it's a left-sided pathology, then S3 is better heard at the mitral area, and if it's a right-sided pathology, then it's better heard at the tricuspid area. Maneuvers which increase the venous return, like passive elevation of the legs, increases the intensity of S3. Sometimes we might get confused with other diastolic sounds, like opening snap or a split S2, but an opening snap which occur during mitral stenosis or tricuspid stenosis will be associated with the diastolic murmur and usually with a loud S1. And a split S2, which is best heard at the pulmonary area, may sometimes vary with respiration. But the easiest way is to compare the sound using the bell and the diaphragm of the stethoscope. S3 being a low-pitched sound is best heard with the bell of the stethoscope, unlike others which can be best heard with the diaphragm. Now let's listen to S1 and S2 for a couple of seconds. Now with the third heart sound. Thank you for watching, and I'll catch you in the next video.